what new technology has emerged in your discipline? And I'm not talking just in the last few years, but we've seen over the last 50 years quite phenomenal advances. Doctors 50 years ago wouldn't comprehend what's available to doctors today. In your specific discipline, how has technology changed and what difference does it make to your job?
I would start at the back. How it makes my job difficult is knowing about available technology but not available to us. There's one technology that we are very thankful for is the availability of a Lodox machine for the last 7 years, which seeing is believing. The difference it makes that you can do a quick X-ray and get a lot of answers even before you start examining the body.
I'd like to come on to imaging in particular. What can you see on or inside a body now, which your colleagues 20, 30 years ago wouldn't have been able to see? And why does it make a difference to be able to do an internal examination from the outside rather than having to cut?
Firstly, I don't know about 20, 30 years back, X-ray technology was available then. But before, and I mentioned our specific advantage in having Lodox X-rays available at the two major mortuaries in Cape Town, is that now we don't have to make arrangements with hospitals to transport a dead person to the hospital and use their facility. Seeing is believing. You look at an X-ray and you see a lot of information that you wouldn't see from the outside, and sometimes wouldn't be that obvious when examining the internal organs, only by looking at them. So you already get a preview of what you're going to find inside, and sometimes you get a lot of extra information that you would not have had if you only did the macroscopic autopsy. But we still do both. Sometimes we are in a position of being able to diagnose a natural disease by only doing the X-ray. And you can immediately be satisfied that this is a natural death. You can actually diagnose a pneumonia and not have to do an autopsy.
David, would you like to add to that the role of imaging?
Well, our experience again is very similar. Because of our new facility, we also have a CT scanner in the same room as the Lodox. So we have the ability to choose the two different modalities. And really the difference between the two is the CT scanner will give you 3D information, which to a forensic pathologist is just absolutely wonderful, because we are 3D animals. When we examine organs, they are organs, they're all a 3D object. So getting the CT scan information really does help. But the Lodox, what that does is it really makes the forensic pathologist so much more efficient. And I think one of the things that, again, has been recognized in the United States by the administrative side and people who are providing the funding is that forensic pathologists are expensive specialists to hire. We're on the state dollar. If you can make them efficient, make their workflow efficient, you can then get a lot more done and get more bang for your buck, so to speak. And so providing us with these advanced imaging techniques, we see a lot of shooting cases in Baltimore. For the forensic pathologists to know where all the ballistic fragments that they have to recover for evidence are before they even start makes life so much faster for them, so that we can get things done accurately. We know we haven't missed anything. We can get that body back to the family who are waiting for that particular individual. They can get on with their funeral arrangements, etc. Again, it just moves the process through. But it also helps the law enforcement officials. If they've got accurate information quickly, it allows them to investigate their crime while things are still fresh in everybody's minds. They can find witnesses. They know what's going on. And also they'll be able to tell when some of the witnesses are not giving them the absolute truth, because that autopsy combined with the imaging. And so, in many cases, as Linda said, it will replace the autopsy. It's also very useful, for instance, in cases where you have certain religious groups who don't want the autopsy done. but you still need that accurate information. Both the Lodox and the CT allow you to meet many of those religious or cultural needs without stomping all over those and causing even more pain to a family that's going through an excruciating period in their lives. So I think there are just multiple different ways that this advanced imaging works.